The saying that security is everybody's business is a statement of fact, and fact is a truth, because if everybody puts hands together, then we'll be able to have the security we deserve. Welcome to your program today. My name is Patrick Abambu, and we are still on this channel that gives you all information you need to know about Africa. It's Africa Independent Television. Welcome. Today on this program, we'll be looking on a number of issues that are very, very important to our lives. But I want to comment on one issue that troubles, disturbs all of us, the issue of security in the country, Nigeria. It can never be overstressed about the need for us to ensure that we have that security which we deserve so that economy and development can improve. So far, we're having scarcity in food supply because those farmers are not able to go to farm to do their farming. Vehicles cannot go to bring this farm produce to the city centers so that we can have. So it's been a big problem. So we must all put hands together to ensure that security is sure. We can't leave it to government alone. We must do our own part to ensure that we have security. Yes, in line with that, the Chief of Army Staff, Lieutenant General Farouk Yahaya, during the week did one thing that is very, very important, motivating personnel. He presented vehicle to the RSM. RSM in the military or in the army particularly is called regimental sergeant majors. These are people that instill discipline, that groom soldiers, that inculcate in them the character and culture of soldiering. And it's good to encourage them to do it better, especially at this time where there's need to improve the discipline level in our services, particularly the armed forces. I must commend the Chief of Army Staff for doing that and encouraging them, especially at the front line where it matters most. The Army, I must say, is overstretched. They are doing everything they can to ensure that the country, Nigeria, is safe. We're calling on the Nigeria Police Force, whose responsibility is internal security, to ensure that Nigerians have the security which they deserve. On that note, I must also remind you that coronavirus is still here with us. We must ensure that we observe all protocols. Like you can see, well, anytime you are appearing in public or where there are more than one or two persons, you ensure that you put on your face mask, just like as I did, not pulling it to the chin like some people would want to do when they want to talk or communicate with people. You must wear it to cover your face and your nose. That is the proper way. And that takes me straight to our report on what is happening with vaccination against coronavirus in Nigeria. Sit back as we bring you this report by Elizabeth TANKO.
With the rising cases of coronavirus infection worldwide, arising from the discovery of the Delta variant and the third wave, many people are worried. But in Nigeria, the National Primary Healthcare Development Agency, NPHCDA, says that if Nigerians keep to all preventive protocols, the impact may be minimal. The Executive Director, Dr. Faisal Shuaib, during its weekly media briefing, added that COVID-19 vaccination being carried out in the country so far has been successful. Dr. Shuaib disclosed that a total of 3,938,945 eligible persons have been vaccinated across the country. This figure, he says, represents 98% utilization of the Oxford AstraZeneca vaccine the country received from COVAX facility in March 2021.
Nigeria has successfully vaccinated 3,938,945 eligible persons across 36 states and the FCT. This represents about 98% utilization of the 4,024,000 doses of the Oxford AstraZeneca vaccine that we received from the COVAX facility in March of 2021. This comprises 2,534,205 people who have been vaccinated with the first dose and 1,404,205 people who have received their second dose of the vaccine. In the course of this exercise, the country recorded 14,550 cases of mild to moderate adverse events following immunization, with only 148 cases considered to be severe.
Speaking further, the executive director revealed that Nigeria will soon receive consignment of more Oxford AstraZeneca, Pfizer-BioNTech, and Johnson & Johnson's vaccine between the months of July and August 2021.
We have also received communication about the delivery of the following vaccine shipments in the coming weeks. Firstly, 3,924,000 doses of the Oxford AstraZeneca by the end of July or early August 2021 from the COVAX facility. Secondly, 3,930,910 doses of the Pfizer-BioNTech or Moderna COVID-19 vaccine in August from the COVAX facility. This has been donated by the United States government.
Speaking on behalf of the World Health Organization, WHO, in Nigeria, the country representative, Dr. Gazadi Molumbo, says that all vaccines supplied in Nigeria and Africa are of the same standard with the others globally.
I would like to reassure the press that WHO does not support any requirement for proof of vaccination to travel. This is because we are still in the curve of inequity. We need to ensure that all the countries, all the continents are adequately covered before issuing such a recommendation. It's very important that as members of the press, we also spread the same news. There is no such thing as substandard vaccine for Africa and the high standard vaccine for the rest of the world.
Peter Hawkins, the country representative of the United Nations International Children's Fund, UNICEF, in Nigeria, urged the citizens to go out and get vaccinated, as it is safe and will help to reduce infection and mortality.
I want to end my plea to all people in Nigeria. When the vaccine is available, please demand to be able to take it. It is there for you to take your social responsibility, to protect yourselves and to protect your communities and your families.
As many nations are currently grappling with more resistant Delta variants, Nigerians are enjoined to adhere strictly to all medical and non-medical preventive protocols. Elizabeth TANKO, Security Watch Africa, Abuja.
Yeah, welcome back. Just like the report said, we are not back yet. We are not out of coronavirus pandemic yet because it's still ravaging many parts of the world. Even in Nigeria, the infection reports, cases are going higher now than it used to be some weeks ago. Some weeks ago, we had less than 20 per day or 30 per day, but now we're having 200 plus. So we need to ensure that we observe all protocols. Yes, one other area in checking insecurity within our cities, particularly in the Federal Capital Territory here in Abuja, it's the impact of street hawkers, and it's been a big challenge because really some of them are genuine street hawkers who are looking for their daily bread, daily needs, how to survive, while some use that to hide, to gather information and feed the criminal gangs. Sit back as we bring you this report by Peggy AGBEH on what is being done with street hawking in the Federal Capital Territory.
Enforcement of laws prohibiting street hawking in Nigeria has been a major challenge facing many states and the Federal Capital Territory Abuja for so many years. Street hawking, which seems harmless to a layman, constitutes security challenges, accidents, and unthinkable crimes. Some people, in the pretense of selling, spy on a particular terrain, knowing the environment, plan and execute robbery, kidnapping, insurgents, and unrest for residents. Arising from cries of many Abuja road users on the menace caused by some street hawkers, Security Watch Africa was at the office of the Director General of Abuja Environmental Protection Board, Dr. HASSAN ABUBAKAR, to find out if there are laws prohibiting street hawking in the Federal Capital Territory, Abuja, and what is being done.
The Abuja Environmental Act of 1997 is the one that gave us the mandate to arrest them. Our mandate is to keep this city clean. Remove this city, remove every form of nuisance in the city. So if people can cooperate with us, you see, we need to have a befitting federal capital city, not just a shabby federal capital city. So they should cooperate with us to clean this city and make it a perfect city, perfect one for everyone to live, so that we can have fresh air. Not just this one selling sugarcane on the road, this one will go to Ahmadu Bello and start selling mango, this one would throw this thing. It's not a good one for us. Let's give a good image of this country. Abuja is the one that portrays the image of this country. So if we don't keep it clean and we don't, we will not be happy.
On the dangers posed by some hoodlums who disguise as street hawkers, Dr. HASSAN had this to say.
These hawkers you are talking about are not really hawkers that you think. We've been arresting them with very dangerous weapons. You came to my office one time, I showed you. I've been showing you a lot of weapons that we are. You see somebody selling an item that is not more than 2,000 naira. And he will be selling it from 6 o'clock in the morning to 6 o'clock in the evening. Even if you buy it 1 million naira, he will not sell. Because that is not what he is selling. His main aim is another thing. He's on surveillance, so that later he can come back and attack. We have been arresting them. We have been following them. We have even been arresting car snatchers, car theft. We have been arresting them when I was in Area 3 as Director of Monitoring and Enforcement. So these are the things. We are trying to protect people. We are trying to clean the city, at the same time give you protection.
Security is every man's business. Be observant everywhere you go. Avoid leaving uncompleted building sites without proper lock or checks to avoid housing criminals. Report every case of threat within your neighborhood to security officials. If you see something, say something. PEGGY AGBEH, Security Watch Africa, Abuja.
You are still watching your program Security Watch Africa only on this channel, the Africa Independent Television. We'll be looking at issues that affect your security and my security. Yes, we'll be going straight now to the Nigerian Air Force headquarters in Abuja, where 6 young pilots were winged, those combat pilots who are to help provide security and eliminate criminals from the country, Nigeria. Sit back as we bring you this report by SHULLY Daniels.
As part of the Nigerian Air Force continuous human capacity development, 6 pilot officers who recently concluded their training were winged by the Chief of Air Staff, Air Marshal Isaka Oladayo Amawo, at the Nigerian Air Force headquarters. At the winging ceremony, the Chief of Air Staff thanked the President, Commander-in-Chief, President Muhammadu Buhari, for always supporting the Nigerian Air Force, while he admonished the young pilots to always imbibe professionalism in their duties.
Let me use this auspicious occasion to thank the President, Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, President Muhammadu Buhari, GCFR, for his unwavering commitment and support to the development and enhancement of the armed forces in general and the Nigerian Air Force in particular. Indeed, Mr. President's continued support has energized us to strive for the peace and stability of our fatherland. To the young pilots who have just been winged today, I congratulate you for successfully completing the training. I urge you to be relentless in the pursuit of excellence and professionalism as operational pilots while working with your colleagues across other specialties in the service. You must also strive to imbibe the doctrine of jointness and esprit de corps in the forward line as you interact with personnel from our sister services and other security agencies in various theaters of operations nationwide for more enduring results.
The winging ceremony was witnessed by principal staff officers of the Nigerian Air Force headquarters and family members.
Congratulations.
From the onset, right from birth, I always wanted to be a pilot and also wanted to be in the military. And the Nigerian Air Force has given us the platform for that dream. I also want to thank the Chief of the Air Staff for giving us the opportunity and his support.
I'm actually ready, battle-ready pilot. So we are just ready now to be launched into battle and go and fight those insecurity. But in the northeast, northwest, southeast, everywhere, in every part of this country.
The experience was a very difficult one because much was demanded from us as young pilots. With the experience we already have from the Nigerian Air Force, we were able to handle the training as expected of us.
I feel happy. I feel I'm proud of myself, and I thank God Almighty for seeing us through the processes.
The training, generally, pilot training is a rigorous training, but with the background we've had in Nigeria from 401 Flying Training School here in the Nigerian Air Force, I would say it has been a great help considering all other factors. Back in the UK, when I looked at our colleagues from other countries, I really appreciate the background we've gotten from Nigerian Air Force. Yeah, it has really helped us a lot.
SHULLY Daniels, Security Watch Africa, Abuja.
Welcome back. Yeah, we'll go straight to our special report for today, which is on suicide. Suicide in Nigeria is becoming a worrisome, taking a worrisome dimension, and a lot of people are concerned. Security Watch Africa, PEGGY again did a special report on the effects of suicide and how do we prevent it from happening. Sit back as we bring you this report.
Suicide is the act of intentionally taking one's life by one's hand. Most suicides are calculated. Could be due to stress, bipolar disorder, schizophrenia, personality disorders, harassment, bullying, relationship issues, and so on are all risk factors for suicide. Methods of suicide may vary between countries and is related. Commonly used methods in Nigeria includes pesticide poisoning like sniper, slitting one's wrist with sharp objects, hanging, self-drowning, jumping into a moving vehicle, and any other means available. This makes suicide the 10th leading cause of death worldwide. Teenagers and adults most likely commit suicide as a means of ending their fears, anxiety, struggles, and agitations. In recent times in Nigeria, reports of suicide is becoming frequent and many are worried. It is with this disturbing trend that Security Watch Africa had a chat with Susan Johnson DIBAL, a retired lieutenant colonel who is a social worker, mental health psychologist, and a cognitive behavioral therapist. We looked at causes and effects of suicide.
Death by suicide is seen as if it's the common thing, but no one dies by suicide that does not talk about it. A suicide tendency person talks about so many things around him, and we tend to just overlook it. And when we talk about how high it is, it's really, really high. It's very frequent these days. You hear it on the media or families, but because of the stigma that goes with it, people don't want to talk about it.
On age demography, that is, ages of people likely to commit suicide, she had this to say.
There's no age rate because the tendency to think about committing suicide, even the young ones these days, because we have recorded many that maybe a boyfriend has left a lady and she feels the world is ending. She doesn't know it's the beginning of another world for herself. She commits suicide. That's a young. Then the elderly one, when the demand is high on all corners, on all areas of their life, and they feel the world has come to end to what they want, they decide to die by suicide.
Drawing from her many years of experience working in the Northeast as a military personnel, particularly in the front line, retired Colonel Susan spoke on how persons who constantly face stressful tasks can be prevented from committing suicide.
In the army, the only way to prevent suicide is that every soldier should have a buddy. Every soldier should have an intimate buddy that understands you and you understand him. So when you have issues, or when you mention I'm tired, or when you say, oh, this war is becoming to pound on me, that buddy understands and he will ask you a question. Do you want to kill yourself? And when you ask anybody that question, even if he wants to kill himself, he will start thinking that somebody has noticed something on him. Care for your buddy. They must care for each other at all times. Most of the times when we look at people who take substance, who borrowed confidence from substance, are easily those that looked at death by suicide as the nearest thing to them. But if you have a good buddy that understands your situation, he can save you from that. And at all times, if you see your buddy changing in his thought, in his attitude, in his behaviors, all you do is you escort your buddy to anywhere he is going. Be a partner to him. Never leave your buddy.
On possible signs and solutions, she had this to say.
There are signs, but it's because we don't believe in such sign in our African content. Because let me give you an example. Let's say today my friend died and we get to the burial ground. I'll be shouting, I'll die with her. I want to die with her. My sister, the person is just saying it. Nobody is willing to die for anybody. But when the man who has suicide tendency says, I want to die, we don't take it serious anymore because we keep listening to people at funeral places saying, I wish I could die with this person. Then when the man who is on suicide bench wanting to die by suicide, telling you that I feel like dying, it echoes into your brain as if you are on the burial ground. So you don't take it serious. You don't see anything in it. But my dear, that is the beginning of one of the signs. Isolation. You see an individual always want to be alone. That's another sign. Aggressiveness. Most people who have suicide tendency stand on the bench of aggressiveness. Nothing matters to them. Engage in risky behaviors. Because he wants to die, it doesn't matter to him what he does next. Anything, risky behaviors that could lead to him dying by suicide is just for him. Self-harm. Most people who has the tendency and want to die by suicide, they do self-harm to themselves. They cut themselves. They find themselves in where you keep saying, why is he there? It's because there's tendency in him that he wants to commit suicide. Their mood and behavior changes.
There was an issue of a teenager who committed suicide because he couldn't afford the National Examination Council NECO form. Who should be blamed for such actions?
There are two ways to look at this. One, it could be peer group action. He has seen all his peer groups have bought their NECO forms and he hasn't got his. And maybe from the parent, they too don't have. And again, the other angle we should look at it is that him committing that suicide, dying by suicide at that time because he couldn't buy NECO form. It's not just sudden. That child must have met 2 or 3 people to give complaint of what his immediate needs is. And when he now find out that even the parent could not help him, his friends could not help him, If you check out, that child is a brilliant child who wanted a future for himself. But because at that moment, no one could look into his thought that he needs that equal form for him to pass his exam. That aspect of life is said every time. That child did not just commit or die by suicide because of just that form. There are so many things surrounding that child that he cannot quantify, that he cannot see. Then combining everything at that moment, my parent can do it, my friends can do it, I can't get someone to do it for me. What is the life all about? At that moment, that's the thought that matters to him. But if people have taken a step to counsel him, that yes, like the parent, yes, we don't have the money, but we'll try to get the money for the next one. You can hold on. If somebody has talked him through, I don't think that child could have led himself to this action.
If there is a law against suicide, retired Colonel Susan had this to say.
Yes, there is a law. Suicide is a crime in Nigeria. According to Section 327 of the Criminal Code, if someone tries to commit suicide, is punishable under that code. But how many attempted suicide persons are brought to book? Because it has a stigma that goes with it. Even if a child attempts to commit suicide, parents cover it. Because it is a stigma that nobody wants to talk about it. But there is a law on that.
Finally, she gave ways of prevention and advice.
Let there be awareness by government, by individual NGOs. People, there is a suicide prevention. There are people who have NGOs just for people who die by suicide. Let there be more awareness. The only thing, awareness and care for each other. If we care for each other, that means I will tell someone and you will tell someone, and that's another way that we can talk about prevention.
Suicide can be prevented if we all care, listen, and reach out more. Before you think of taking your life, remember that your mistakes do not define you. You matter. You are special and loved. Don't give up yet. Peggy AGBEH, Security Watch Africa, Abuja.
Welcome back. Yes, seriously, this is an issue that needs attention seriously by everybody, not just the government or the persons concerned, but the society must pay attention to each and every single one of us. Sadly, we have come to the end of the program today, but if you have enjoyed watching us, join us again next week so we can do it again better than this week. Watch the previous edition of this program on YouTube so you can get other information that you need. Until we come over again next week, I say thanks for staying tuned and bye for now.